Hi, I'm Chris Urquhart, publisher of Natural Awakenings magazine, and I'm here today with the doctors of Smile Design and Wellness Center. Smile Design was established in 2003, and they offer biological, holistic, and minimally invasive dentistry where technology and caring come together. Thank you so much, everyone, for joining me today.
Thank you.
Thank you.
Thank you.
So, Dr. Edwards, we just introduced it as you do biological dentistry. So what exactly is that?
That's a question that comes up often when patients hear that. Biological dentistry is doing dentistry in a way that is more natural and takes into account the whole person. It's not just looking at a tooth or a few teeth. It's looking at how that mouth relates to the whole body. And it also involves using techniques and materials that are more in support of health, doing things more naturally, as well as materials that are more in harmony, with the body. And it looks at the root cause of why is something not right. And I think a biologic dentistry also focuses on prevention, which is how the patient themselves can take an active part getting themselves healthy and keeping themselves healthy. So it's a pretty wide-ranging spectrum of ideas, concepts, and treatments. And one of the things is that we use a lot of technology in our practice that help us to be biological dentists. And with that, I'm going to hand the microphone to Dr. Rob Brown, and he's going to speak a little bit about lasers.
Thanks, Chris. Yeah, lasers are one of the tools that we use in our office for a variety of reasons. One is treatment. We have lasers, and basically what a laser is little packets of light that are focused to a point where we can use them for treating teeth, diagnosing decay, which is also a great benefit. We use a lot of diagnostics, but one of our key efforts in our office is to really come up with a good diagnosis before we provide any sort of treatment. So, and lasers are one of those tools that we can use to diagnose decay in the mouth. Another laser that we like to use, it also promotes healing or a biomodulation of the tissues to stimulate healing in the body. So in our practice, like Dr. Edwards said, using the body's own healing is one way that we can get better treatment outcomes. And I'll turn it over to Dr. Freimiller to talk about another one of the modalities that we use to try and promote better healing.
Yeah, and so that modality is called PRF, which is Platelet Rich Fibrin. And we use this after we remove teeth. And so what we do is we take some blood from your arm and put it in a centrifuge that kind of spins it down and separates the cells. And we're able to take out the stem cells and then also the healing factors. And we infuse our bone grafts with that. And what that does is it just kind of jumpstarts the healing process so that our patients have less inflammation, which means less pain for them. And within a week or so, we see healing that typically we don't see for 3 or 4 weeks normally. So it really does jumpstart the healing process by using the patient's own blood. So it's all natural. And like Dr. Brown said, just really using the patient's body to heal itself. So I'm going to turn it over to Dr. Edwards to talk a little bit about ozone then and how we use that.
Thank you, Haley. PRF has become very widespread, but we were some of the first users, I think, in dentistry for sure. Over 10 years that we've been using that technology, and the healing is amazing. I wanted to talk a little bit about ozone. Ozone is again, one of those words that people think it's the gas and the pollution in the atmosphere. And the reality is that ozone is a very powerful healing modality. It normally it's O3 instead of O2. O2 is the oxygen we breathe. O3 is where the O2 has been split apart, and now that jumps onto another O2, and now you have O3, and that becomes sort of an oxidizer, a very unstable molecule that has a lot of powerful benefits. It kills bacteria, funguses, and viruses, which obviously we're all dealing with these days. And it also upregulates healing. Every cell in our body needs oxygen. And this just helps your body. It makes the stem cells, get into gear and decreases inflammation, decreases pain. And, and there's a lot of cases where, for example, decay, which is bacterial, actually there's a mixed flora that's in decay. Oftentimes, the nerve is affected, and with ozone, we're actually able to kill those bacteria and save the pulp of a deep cavity that most dentists would say couldn't be saved. So, ozone is really powerful. Another way is that we ozonate the water that we use in our treatment rooms. And ozonated ozone cleans the biofilm out of the little tubes. So the water that we're using in our drills and to rinse your tooth and the like is much cleaner. So that's another benefit that, is to us, because that's a spray that's around, that we're all breathing. And so we use ozone and ozone oils and a variety of ways. So ozone is just another one of those biological, tools that we use to help the body to heal itself.
It's really exciting to hear that you have so many options that growing up, going to the dentist, this never would have crossed someone's mind that these were things that we can have for our oral health. So I think it's very exciting that it's just sharing a few of the options that you have. Dr. Freimiller, are there some things we can be doing at home between cleanings to keep our oral health strong, especially right now while we're recording this, we're under stay-at-home orders and missing, I know I myself am missing a regular dental appointment.
Yeah, so I mean, the obvious ones are brushing and flossing. So we want you brushing twice a day to get the bacterial plaque off kind of the fronts and the backs of your teeth, and then flossing to get it off the sides of your teeth where your toothbrush can't reach. But you could also be doing saltwater rinses just to kind of keep the bacterial level in your mouth low. Staying hydrated is really important to keep your salivary flow, keeping enough spit in your mouth. And then right now, everybody kind of just wants to snack all day because there's not a lot else to do. But that's really not a great idea for your mouth because you're constantly introducing sugars and carbohydrates that then feed those bacteria that cause cavities. So just keeping things clean and limiting the snacking are probably the best things that you can be doing right now.
That makes sense. And since we're at home, we do have access to a toothbrush, so there's no excuses.
Yeah. You can brush it every meal now.
Right. So Dr. Brown, with COVID-19, has that impacted your office at all in just procedurally and things you need to do to keep people safe?
Dentistry in general has always had very high standards as far as infection control. We learned from the very first year of dental school what's called universal precautions or universal protections, where we use specific personal protective equipment to keep us safe and to keep our workers safe, to keep our patients safe as well. During this time of pandemic, right, we're being instructed by government agencies to do other things to try and even take it to a higher level. And in our office, we are well aware, very much up on the latest news, education, and as far as new personal protective equipment type of standards that are suggested. And so there are some new procedures like, peroxide rinses that we're having our patients do at this time, again, washing your hands is not anything new, but we're very diligent and vigilant about making sure we're practicing good hand hygiene with all of our procedures. But as a whole, dentistry has always been at the forefront of infection control. And so coming to the dentist is, for me, and in my opinion, one of the safest places you could be during any time of uncertainty when pathogens are spreading.
That's good to hear. So when we open up and we can come back to the dentist, we can all feel safe and secure and take care of our teeth. So that'll be great. So Dr. Edwards, your practice has been known to always stress the connection between oral health and overall health. Can you maybe share a little bit of that with us, as well as could it possibly impact the immune system?
Well, I think that it's really become quite understood, particularly with functional medicine and integrative medicine doctors, that if your mouth is not healthy, you cannot be healthy. And it's that simple. And it's interesting that Dr. Rebecca Hunton, who's my physician, she's shared with me that she does a lot of testing and of our patients. And, when C-reactive protein is up, that's a marker for inflammation. And inflammation it's the killer in a lot of ways, in so many different diseases. And one of the very first places she looks is to the patient's mouth, because she knows that, if there's inflammation in the body, it could be coming from the mouth. And usually that's gum disease. So, the importance of regular care at the hygienist, as well as your own self-care, as Dr. Freimiller has said, are crucial towards that. And if your gums are bleeding, you have serious inflammation, because many patients say, oh, my gums don't bleed. Yet the reality is that when we go ahead and check their gums and do a periodontal evaluation, oh, there's a lot of bleeding, and bleeding of what we call upon probing, then we know that there's actually inflammation. And when there's inflammation under those gums, it is a way that the bacteria can easily enter the body. And there's the jury is in that a lot of serious illnesses, heart attacks and strokes, and the relationship to diabetes, etc., are from oral bacteria. So, I just encourage everyone to really think about what is this condition of their mouth, and what are they doing on a daily basis to try and keep their mouth healthy. And, it's so important. I don't think that we realize this. When I went to dental school, we were sort of taught a little bit about this, but boy, it has really come full circle with research to really back up the fact that they're finding oral bacteria in the brain and in a clot that's in a stroke victim. And it's like, oy. And we know that they're getting in the bacteria. So, and that relates to a healthy immune system, which, again, is so important in these days, because, we're all susceptible to diseases, and the healthier our immune system is, the better our opportunity is to be able to manage that infection. So, I hope that, people really, I think the word is out on this. A lot of patients will come in and say, yeah, I heard about, you can get a heart attack. Yes, you can. So, I don't know whether that answers that question, but, I'm pretty passionate about it. So.
Yes, thank you. And it also occurs to me that if we listen to Dr. Freimiller and do our brushing and flossing, especially at home, then we may know if we have bleeding in our gums. If we're not flossing, we probably aren't aware and need you to tell us. So another reason to do that is to make sure we don't have inflammation. So Dr. Freimiller, you have a specialty in dental oncology, which is probably, not obvious to a lot of us, where the connection is between dental care and cancer care. Can you share a little bit about that?
Yeah, it's something that's not obvious to a lot of physicians or dentists even. I've got a lot of people that come to me and they're like, I've never even heard of this. What is that? And so basically what dental oncology is a niche of dentistry that's getting patients ready for their cancer treatment. So radiation treatment and bisphosphonate treatment and chemotherapy in particular. There's certain cancer treatments that afterwards you're unable to safely get extractions or implants or any kind of oral surgery. So we want to try to make sure that patients' mouths are as healthy as possible before they start that cancer treatment while they still have the ability to heal well, to kind of prevent problems down the road. And then kind of the flip side of that is I see patients who have already gone through cancer treatments that are now having mouth problems. And because they've had this cancer treatment, we're not able to do traditional dental procedures on them. So we've got to kind of think outside the box and figure out how we can safely treat them and get their mouth back to healthy without putting them at risk. So
Thank you. That sounds really important. And if you've got cancer, it's probably not the first thing you're thinking about. So it's good. It's really great to get that out there. So we're aware that that's just one more thing to be cautious of.
yeah.
And it relates to the oral systemic connection, because if you have cancer and you're going through treatment, you need to get your immune system as healthy as possible so that your body can actually help beat the disease, because it's actually the immune system that really is the one that finally makes the difference. The medications and the treatments are all helpful, but if you don't have a healthy immune system, you might not make it.
Yeah.
Back to holistic. It's all connected, isn't it? So balance.
Yeah. It is. We're all one, and it's interesting that there's 70 trillion cells in the body, and innately each cell knows what every other cell is doing. There's an innate intelligence, and we're all connected. Just as I think we're all connected as humans, it's sort of where I think we're realizing that also, and we're connected even in a greater way to the trees and the plants and the animals and the insects. It's all one.
Exactly. I was thinking the exact same thing as you were talking about the connection there. But thank you so much for joining me today. I enjoyed this conversation quite a bit. So for everyone watching, if you'd like to connect with the Smile Design and Wellness Center, Dr. Brown, Dr. Freimiller, and Dr. Edwards, they are in Viera, Florida at 5445 Village Drive. And you can reach them by calling 321-751-7775, or even easier, jump online and check out their website at smiledesigncenter.us. Thanks again, doctors, and everyone, be well, stay connected.
Thanks, Chris.
Thanks, Chris.
Thank you.